Let's take you here now. World Health Organization Director General Dr Tedros Ghebreyesus is receiving an honorary doctorate from the University of Pretoria. Let's take you live there now.
To a student in life, I was asked to talk a bit about my own journey, so I thought I would do that by focusing on 4 themes, rather 5. First, anything is possible. Second, challenges come with opportunities. Third, continuous improvement is important, change as a constant. And fourth, humanity first. I think the 5th one, the last one, I will tell you when I end the speech. It's a surprise. First, anything is possible. As a child growing up in Ethiopia, I saw firsthand the effects of violence, poverty, and disease in my community. And I belong to a poor family. As yet today, here I am, Director General of the World Health Organization. It's certainly not something I ever expected would happen, because when I was a child, my mother's only prayer was for me to survive just a day. So what's the lesson there? A better future is possible. And in the meantime, work hard, because you never know when you may face a great challenge and when your chance to shine will come. The second point then is challenges come with opportunities. When I took on this role as Director General of WHO, I did not know that we would soon face an Ebola outbreak in North Kivu, in the Democratic Republic of the Congo. This was a place of unrest and violent conflict. It took 2 years to contain, working long and hard with our partners in government and in the communities. In the process, we lost 2 of our colleagues, murdered in cold blood by armed groups who operate in North Kivu. Of course, Ebola was followed by the COVID-19 pandemic. This was a challenge on many levels. As you know, unprecedented challenge. This was a new disease, which we had never seen before. And it was accompanied by a second pandemic, a pandemic of misinformation and falsehoods. WHO also faced significant pressure due to geopolitical confrontations, nationalism, and the politicization of COVID. The only way to deal with such extraordinary difficulties is to stay focused on your work, following the science and the evidence, and to keep people at the center of our efforts. And that's what my colleagues and I did throughout the pandemic. So when the challenges come, as they always do, you must be prepared and you must be ready. As I often say, the time to fix the roof is before the rains come. Which brings me to number 3, continuous improvement, change as a constant. That means learning lessons by assessing where we have been and where we're going. WHO was founded 75 years ago in the aftermath of the Second World War in 1948. Over 3/4 of a century, WHO and our partners in countries and communities had many accomplishments: eradicating smallpox, pushing polio to the brink, global curbs on smoking and trans fats, increasing life expectancy. We have played key roles in the fight against diseases like HIV, TB, Ebola, malaria, measles, you name it. At the core of our work is the belief that global cooperation and solidarity can help us to reach the highest possible level of health for all people, everywhere, as WHO's constitution says. Throughout, our focus is on continuous improvement. These transformational changes began even before the pandemic, as Dean indicated earlier. As Director General, my priority is to make sure that WHO is ready to take on the challenges of the next 5 years. This includes strengthening our health emergencies, science and data programs, improving the global health architecture, and focusing on country impact. We're also working to nurture future young global health leaders from Africa and around the world. It's critical that now, with the recent challenges of COVID-19, we learn its lessons. Profound inequities badly undermined our work to contain the pandemic, especially in the unequal global distribution of life-saving tools like vaccines, tests, and treatments. It was a clear demonstration that the global system is in need of repair and rethinking, because health for all means all, rich and poor, north and south, east and west. To address these inequities, WHO and partners established the mRNA Technology Transfer Hub here in South Africa. Local production is critical to preparing for the next pandemic or epidemic. 15 countries from Latin America, from Africa itself, from Asia, Europe, are collaborating with South Africa to ensure local production and address the equity issue. I visited the hub yesterday. The progress is remarkable, with huge promise for increasing access to vaccines of COVID-19, but the technology of mRNA can also be used for HIV, tuberculosis, and other diseases. WHO is also committed to supporting the Africa Centers for Disease Control and Prevention and the Africa Medicines Agency. Because as we look to the future, Africa should never again be the last in line to receive vaccines, tests and treatments, and other life-saving tools. So whenever you have challenges, take it as opportunity to find improvement. That's what I try to do every day. And I remember often where I came from and how I got here. It's truly a privilege and an honor to work at WHO. The fourth theme is humanity first. Whether you go on to work in the public or private sector, please always put humanity first. These pandemic years clearly demonstrated that nationalism and selfishness hinder progress. They do not help. When I say nationalism, narrow nationalism. Of course, enlightened nationalism could be okay. It's also clear that health must be at the center of all we do. As you have all seen, health crisis can affect societies, economies, and stability. When health fails, everything can fail. Make no mistake, dear graduates, my colleagues and friends, you're graduating at a very difficult time in the world, with a climate crisis, profound inequality, major conflicts and wars, and injustice. We must put health and humanity first, with solidarity and global cooperation, because the world does not get better unless we work together to make it better. So, throughout your careers, keep listening and learning and trying. Try everything. Because, as Madiba taught us, we can all make a difference. And that takes me to the fifth theme, which I kept. This is about my son, my daughter, my son are graduating today. Pave the way. That's a song I selected for you. Brenda Fessy. And all the best, and I thank you. And again, thank you so much for this great honor. And when I take this honor, I take it as recognition for WHO. Proud to be WHO. Thank you so much.